Good morning. This is Dave, Communications Manager. I want to welcome everyone to our COVID-19 news conference for the latest and information to the community. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll go ahead and open it up to our panel for statements, and then we will take questions from our media who are in attendance. Mayor Ginger Nelson. Mayor, how are you today?
I am doing well, Dave. Thank you so much. I'm a little bit emotional today because it's our last press conference with our COVID team here, and we have really bonded through this experience of the time that we've spent together virtually. It's ironic, these doctors, not Dr. Milton, but the other three of you, although Dr. Lamentier's not with us today, I've only met you in person one time, but I feel like I've gotten to know you because we've spent so much time together virtually and really in front of the camera, in front of the community, working and serving together. Because it is our last press conference related to COVID today, at least our last regularly scheduled one, it does feel like we're putting down a mark in the timeline of our city's history today. And it has me reflecting on other hard times that our city's been through. And so, whether it was the 1920s and the Dust Bowl era or the 2020s and the pandemic era, what I know is that Amarillo is still here. And this last year, we have spent a lot of time and energy focused on surviving. And it's time to transition that now. It's time to transition into more of a thriving mindset. And we're all ready for it. I know the doctors are ready for it. I know the nurses, the hospitals are ready for it. And I know that we as citizens are so ready for it. I don't want to pass over what I think is the most important person to be acknowledged. And that is truly God. We have had his protection and his favor over our city for the last year, actually year in and year out, whether we've stopped to acknowledge it or not. But certainly this team in our city has felt his favor and his protection over the last year, and we would be lost without him. So I just want to acknowledge him and how grateful I am for how he has taken care of our city and our people. I'm very grateful for the medical experts that we've had on this panel. They have been faithful. They have been dedicated behind the scenes and in front of the scenes. They've been generous with their time and their expertise, and they've been courageous with their opinions, not always agreeing with each other or with elected officials, but definitely willing to share their expertise. And I will always, always be grateful to you. But most importantly, Amarillo, we've had each other. And so while we haven't been able to see you on the other side of the screen, we've known you were there, and you've been watching, and you've been doing this journey together as a city. And that makes me so very proud as a leader, knowing that when things got hard, we came together. So I wanted to say thank you. Thank you for watching. Thank you for your prayers. Thank you for the faith that you had in both our God and our local medical community and our local elected officials and our public health officials. Your commitment to watching, staying engaged, being informed, and just being a source of encouragement in the community has been very meaningful. And I hope we won't need that again for a very long time. I can't tell you how grateful I am for the folks who have worked on the vaccine, both in developing it scientifically, but also in rolling it out across our city. Truly, you're saving lives, but you're saving not just our physical bodies, you're saving our way of life. And it feels so good to be out in the city doing traditional normal events, graduations, birthday parties, weddings, funerals, and knowing that we can be together, and we've missed it, and now we appreciate it. And it is because of that vaccine that we're able to do that. So I would encourage you, if you have not yet gotten your vaccine, please investigate doing that. There's no cost. And the city clinic is easy. You can just walk right up and get a vaccine. That's really all that was on my heart today, was just a tremendous amount of gratitude and a thank you to everyone on this panel and to everyone who's watching. I'm so very glad that we are through this, and we've really made history together. Thank you, Dave.
Thank you, Mayor. Let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you?
I'm good, thank you. Thank you, Mayor. I'm pinch hitting for Casey today, so I'm going to run through the numbers as best as possible. As of yesterday, there were 34,344 cases of COVID-19 reported in Potter and Randall County, 17,485 in Potter and 16,859 in Randall County. We have a total of 33,066 recoveries and 757 deaths reported in Potter and Randall counties. This leaves us with 521 active cases. The 7-day rolling positivity rate is around 2%. The positivity rate at the drive-through testing site, which is a subset of that total, is at 10%. And the 5-day new case average is at 27 new cases per day. Our hospitalization percentage is at 3.03%, meaning that just over 3% of all hospitalized patients have COVID-19. The public health drive-through test site remains operational. Individuals can call 378-6300 to be screened and directed to the test site. The vaccine clinic is also operational at the Amarillo Civic Center's entrance number 2. Today, we will be open until 5 o'clock. For clinic times and other information, please check out AmarilloAlerts.com. All adults are eligible for the COVID vaccine. We have the Moderna vaccine at the City of Amarillo Clinic, so we can vaccinate all adults 18 and over. To date, the Amarillo Public Health has given out 74,154 first doses and 57,092 second doses, for a total of 131,243 doses of Moderna given. Also, there have been 262 doses of the Pfizer vaccine given to adolescents aged 12 through 17. We will be at the Southwest Library tomorrow from 10 o'clock till 5 o'clock. Basically, that's all I have, Dave. Thank you very much.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. How are you today, Dr. Weiss?
Good morning, Dave. Well, I am ecstatic. I'm ecstatic that as a community, we have reached this point where hopefully we can put the vast majority of COVID-19 in the rearview mirror. You know, and even more is instead of that same tired message every week of wear your mask, now I'm asking, please get vaccinated so you don't have to wear your mask anymore. So that's a take-home message today. You know, for the last 14 months, we've talked a lot of negativity on this, on this broadcast. And I want to point out a couple positives as we kind of look back. And I think the first one is the science, as the mayor mentioned. We have seen truly a revolution in science. You know, what they call the central dogma of molecular biology used to say that information in biological systems went from DNA to RNA to protein. We now know that that's not right. Okay? And over the last couple of years, the Nobel Prize winning work of Dr. Jennifer Doudna and her collaborators have shown us the central importance of RNA in biological systems. And thus you look at an RNA virus like COVID-19 and what it's done. Well, that technology led to these RNA vaccines that we developed. Essentially, we use fire to fight fire. This is beautiful technology. In less than a year, we had these vaccines come out. I think they're the cleanest and safest vaccines we've ever created. And even more is they're obviously the most effective vaccines we've ever created. So my hope is that this RNA revolution we've seen will now lead to vaccines to other threats like HIV, Ebola, or other hemorrhagic viruses. So this is very, very exciting technology. But the second positive is the human side. I mean, You think about, the old cliche is when the going gets tough, the tough get going. And boy, did we see that over the last 14 months in this community. So we saw our first responders, our medical personnel, and essential people in this community continue to do their jobs despite fear and anxiety and the threat, just to keep us all afloat. But even more, as you saw those people whose businesses were at risk or their livelihoods were at risk, what did they do? They brought resources to the hospitals in the form of food and public demonstrations of support and messages of goodwill and hope. Unbelievable. I can't tell you how meaningful that has been for all of us to see that. I would say, I hope I'm not around for the next great pandemic, but I sure feel privileged to have seen this one. So let's talk about the numbers at Northwest, because it's all very favorable. So right now we have 7 COVID patients in our hospital. That's 1.4% of our licensed beds. Now, it has not been since March 1st that we have exceeded 15 patients in our hospital with COVID-19. So we continue to see that number coming down. We've been staying in the single digits for quite a while. We have 27 people in our ICU right now, only 5 of which are suffering from COVID. And out of the 13 ventilators we're using, only 2 of those are being used for patients with COVID-19. So all very good news. Now, yesterday we tested 120 people for COVID and had 1 positive. That's a 0.8% positivity rate. Now we look back, and since the 3rd week of February, we have not exceeded 10% positivity rate as in our outpatient testing. Again, great news. For the most part, unfortunately, we had 2 people lose their lives thus far in the month of May to COVID-19. That is obviously a tragedy for the families, but boy, a long way from where we were just a number of months ago. We have 0 patients in the hospital receiving remdesivir. And our last dose of bamlanivimab, the outpatient antibody, was given on April 28th, and we've used very little of that combination. At Northwest, we have given a total of 4,679 doses of the COVID-19 vaccine, and that's including some youngsters 12 and up. So we've been giving the Pfizer vaccine for those. And right now, we have only 4 of our staff are quarantined due to either exposure or testing positive for COVID-19. Now, that's important because all of the traveling staff from the Regional Advisory Coalition are gone. So we have no more travelers. We're really dependent on our employed staff right now. So the fact that we can keep such a low number in quarantine is great. I know, my friend Dr. Lamatier is visiting his family after 2 years on the East Coast, and we wish him well. But I know, talking to him, the numbers at BSA, while they're a little higher than ours, are showing the same downward trends as Northwest. And I feel very confident saying that he would express the same appreciation to the community support through this whole year. So David, I know this is the last press conference, and I realize that my 15 minutes of fame is probably coming to an end. So I realize that, it would be a mistake. I'd be remiss if I missed this opportunity to basically drop my F-bomb on live broadcast. I did it. I feel much better now. So as a final statement, I want to personally thank our friends in the media. This has been an incredible year for them, and they have worked so hard to deliver the truth to everyone as much as we knew at any given time. And I can say the local media has been gracious, they've been inquisitive, and overall just been a delight to work with. So I really want to thank them for all their efforts in helping us get the word out to the community. So with that, hopefully for the last time, Dave, I'll say that's all I got for this morning. Thank you.
Thank you, Dr. Weiss. Thank you for the prop. Much appreciated. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you. So first, I'll hit our numbers. Currently, we do not have any COVID inpatients in our hospital. Our positivity rate for the month of May has been 1.8%. And very interestingly, since you had mentioned it, Dr. Weiss, that you had 120 tests, 1 positive, that's our status this week. We've done 120 tests, exact same number, only 1 positive. So also that 0.8%. We have vaccinated, I believe we've given about 12,000 doses of vaccine in total, but we vaccinated 39% of our veterans that we are aware of, meaning we either vaccinated them or they've brought a copy of their card to us so we could document our records. And I want to thank every veteran who has gotten vaccinated and those spouses that may have came to the VA to get vaccinated. We're going to continue to offer the vaccine. And so even though these broadcasts may come to an end, even though we are watching us on the right end of this pandemic, just encourage anyone who is not getting vaccinated to please get vaccinated. You know, one of the things, you know, we always ask, well, what about mask wearing? Do we have to do it? Well, at the VA, we're going to continue wearing masks. You know, so even though I've been vaccinated, I will continue to wear my mask when I'm at the VA facility. And that's to ensure that we have the best protection for all those around us. Now, the VA did send out recent guidance that said in some non-healthcare areas that we do not have to wear masks, but we are a healthcare facility, so we'll continue to wear our masks. You know, I really want to give a shout out to our VA team. The entire team, regardless of whether they work in direct clinical care or they make sure that we have our supplies or they're doing the cleaning, whatever their role is, have been essential through this pandemic. And so I just want to say thank you, appreciate all your hard work. For the same reason, I want to thank the Amarillo medical community. You know, I got here just shy of a year ago. In 2 weeks, I will have been here a year. So that means many of the things to get ready for the pandemic happened before I arrived, both at the VA and through the community. And the team really came together, got us on the right path, ensured we did everything we were in protecting our community and our veterans and seeing how we could get through this pandemic together. And I think together or teamwork are really the key words there. I want to thank the city of Amarillo for allowing me to participate in this news conference. You know, this is a city of Amarillo news conference, and I belong to the VA. The VA belongs, you know, to the federal, but yet they invited me to allow me to participate. It allows me to give a direct communication to our veterans and concern. And so to the mayor and all of her team, thank you for this opportunity. You know, the other thing I just want to remind people that despite dealing with this pandemic, we saw other things over this last year. In February, we had that winter storm. We had snow and ice. You know, even in normal operations, that snow and ice would have impacted healthcare and made it difficult. But despite all those concerns, we continued to go through the pandemic. We were sort of on the downward end of the surge at the time, but we continued to do vaccines. We continue to treat patients. We continue to take care of patients with their chronic healthcare needs beyond just COVID. And so just a really good shout out. And so finally, I just want to say, God bless our veterans. God bless the Amarillo community. And obviously, God bless the United States of America. Thank you, David.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good. Thank you, Dave. I want to start with the Governor's Executive Order GA36, released and signed yesterday, went into effect yesterday. This supersedes GA34. The main takeaway from GA36 is that it prohibits any governmental entity or official from imposing any face covering requirements in a city. There are still, or in any jurisdiction. They are still allowed in schools until June 4th. And that the determination on whether or not they are required in schools will be made by the school districts in accordance with TEA guidelines, Texas Education Agency guidelines. We don't expect any impact in Amarillo. We have not required face coverings except in as directed by the governor through his executive order GA29 from July of last year. And that was rescinded recently within the last few months. We will no longer be having report cards as of Friday. Our last report card will be Friday. Since March 23rd of last year, we've done 309 report cards. We've had an average of 11,370 people look at those report cards on a daily basis. So we've had a lot of utilization of the report cards. We will be stopping that on this Friday. However, all of the information on the report cards is still going to be available daily and will be updated daily on AmarilloAlerts.com. You've noticed a lot of sort of farewell comments on this press conference. Today is the last scheduled press conference for coronavirus. We will still call a press conference if the situation warrants, or if we have changes to what we're experiencing here in Amarillo that warrant a press conference and a widespread release of information in a way where you can ask questions. Since March of last year, we've done 68 press conferences. We've had an average of almost 1,100 views on the city channels. That does not account for TV views and TV website rebroadcasts and things like that. So again, a lot of great utilization of the press conferences, a lot of great distribution of information. With regard to testing and vaccinations, we are still doing testing at the Amarillo Public Health Facility. You can still be referred for those tests by just calling Amarillo Public Health. They will ask you a couple of questions and refer you to a test at the Amarillo Public Health Facility. We are going to continue doing vaccinations at the Civic Center. However, after May 31st, we will be changing the entrance that you come in. Instead of the northernmost entrance, we're going to move to entrance 4. Starting in June, we'll be using entrance 4 at the Civic Center to come in for the vaccination center. That is the northernmost east-facing entrance at the Civic Center. Dave, that's all I have. I'll be happy to answer any questions.
Thank you, Jared. We're now going to go to members of our media who are in attendance. If you have a question for the panel as a whole or an individual panel member, that's completely fine. Let's go ahead and start with Kevin Welch of News Channel 10. Kevin, how are you today?
I'm good, Dave. Thank you. Jared, any other operational changes planned right now besides moving the entranceway?
With regard to the Civic Center, the only other operational changes is what room we're using. We've been using the North Exhibit Hall as a vaccination site and the South Exhibit Hall as a queuing area and paperwork area, and then with lines throughout the facility. The volume is low enough now to where we don't have to wind lines throughout the facility, nor do we have the weather impacts that we were experiencing at the very early on in January and December when we first started doing vaccinations. We will be using the Regency Hall, the Regency Room, which is the room right across from the Heritage Room. It's the first room on the left when you enter through entrance 4. That is where we're doing our data entry and is also where we're going to be doing our vaccinations going forward.
And Mayor, how have you felt about the response to the mobile clinics?
I think we've been pleased with the mobile clinics and the volume of people that we've seen there. Obviously, they're much smaller clinics than the large operation at the Civic Center. And so it's apples to oranges as far as comparing numbers and volume. But we are seeing enough volume to definitely continue doing those programs. And I think they reach different people because they're inside their neighborhood. They're at a location where maybe they go there to either pick up or drop off children, or they go there to work out, so they're familiar with the place and the neighborhood, and they know the staff that work at that location, not necessarily the city staff, but the facilities staff. And so I think that helps us just create another layer of trust with folks who might have some hesitancy about getting the vaccine. I've appreciated the doctor's comments every week, but this week especially, about just how wonderful the science is behind this vaccine and how we can trust it. Every member of my family has been vaccinated, and we are so thrilled to be on that side of it. I had an exposure last week, and so while everyone in that situation went into quarantine, I thought, hey, I'm going to go back to work because I've been vaccinated. So I am seeing the benefits of it. And I think that does translate to these smaller, more mobile clinics that the public health department is implementing in neighborhoods. And so I really appreciate Casey, her leadership and the support she's getting from the city manager's office and other parts of the city to operate those mobile clinics. And we will just continue to analyze the data to see if they are effective, and we'll adapt and change them to make sure they continue to be effective.
Thanks. And Dr. Milton, do you have a sense of where the trickle of new cases are coming from and who those people are?
I think that generally speaking, it's probably individuals who are relatively healthy and younger. There's generalized spread throughout the community. I think, as we all made real efforts to vaccinate those that are most vulnerable. And so I'm real grateful for that because we continue to see cases over 500 still in the community, but our hospitalizations have not gone up, I think, because we've tried to target the vaccine to those who are most at risk of getting really sick from this.
Okay, thank you all.
Thank you, Kevin. Let's now go to Dalton Williams of KBII Channel 7. Dalton, how are you today?
I'm good. Thank you for having me today. I've just got a couple questions. The first one is to the health experts on the board. Obviously, we have the new executive order from the governor saying that we don't have to wear face masks in government entities. And we've been pretty good with the vaccinations and stuff. My question is, do y'all think that we're at a good enough place to kind of start banning these masks, or like not allowing these masks in most places?
I would say that the key to this, and what I would continue to suggest, and what we've all been suggesting on this press conference since we've had a vaccine, is to get vaccinated. I mean, that has been the home run through this whole thing. So, and in terms of what particular entities, I know we got an email last night from our president for the Health Sciences Center here, and that mask order has been lifted. I think that for certain patients that may be at risk, we're going to I'll probably continue to try to mask individually based on their risk and their vaccination status. So that's the way I kind of approach it. I think generally speaking, though, we are at that point.
Those, I would say, just in terms of the hospital, because we know we have vulnerable people here, people who are sick and debilitated, we will continue to mandate masks at the hospital, just as Dr. Gonzalez was saying, the VA. So, and again, mostly because the people we're trying to protect are the ones who are vulnerable. So, but I think in terms of general public, yes, I'm feeling more and more confident as the data comes out on just the efficacy of these vaccines. Absolutely, every day I feel more and more comfortable that if you have a vaccination, you really have nothing to worry about in most situations.
I think it's important to note also that masks aren't prohibited, and right. I'm sure that was probably a misstatement. They're not prohibited. They are, however, not allowed for a governmental entity to require them throughout the city or even in government facilities. We do still recommend them if you have not been vaccinated, and we'll be spending more than 15 minutes within 6 feet of somebody here in city facilities, say if you're in a meeting or if you're working very closely to other people who have not been vaccinated. But it prohibits a governmental entity from requiring face coverings throughout the city or in facilities. And I think it's important to note the timeline of things. GA 29 early July of last year required face coverings by the governor in situations where you couldn't social distance and other situations like that, in businesses and other places. GA 34 superseded GA 29. GA 34 was from March of this year and strongly encouraged face coverings in those same situations, but did not require them. GA 36 from yesterday prohibits governmental entities from requiring them, but does not prohibit face coverings. So, a private business owner or anybody else can wear them or require them to be worn inside their business if they so choose. And I think it's important that we all respect those requests and requirements that different businesses might have, because we are in this transitional stage where not everyone's doing the same thing or thinking the same thing. And I think we need to respect those different opinions and not throw anybody under the bus. But you do what you think you need to do to be safe for your family. I think I would echo what all of the medical professionals have said on this call. Do get your vaccination. I have an enormous amount of peace. Will not have to do a quarantine because of that. So I think there's a lot to be said, a lot of value to be had by doing it.
Okay, awesome. And that pretty much actually answers my next question. So that's all I have for today. Thank you all so much for letting me be here.
Thank you, Dalton. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good, thank you.
First question is, have y'all seen anything indicating that the vaccine could be opened up to children under 12? We know the age dropped drastically this last time, or pretty quickly. Do you see anything coming down the pipe saying that under 12 could be getting the vaccine soon?
I know that there are clinical trials that are ongoing that have to do with children younger than that are ongoing now. So I would expect that in the near future we would start seeing some results from those trials.
All righty. And does anybody happen to know off chance the number of COVID patients at BSA?
I don't specifically. They have been typically they have been in the mid-teens, so 15 to about 18
Yes.
to 20 each day. So just about double what we've been at Northwest, but typically less than 20.
Okay, I think that has to be covered. Thank you.
Thank you, Aaron. That was all the questions we had from the media for today. Once again, this concludes our COVID-19 news conferences through Zoom for the community. I want to thank all of our panel members who have participated in this forum for the last year and a half. You guys have shown your dedication and commitment to the Amarillo community, and I want to thank you guys for that. And thank everyone who viewed these news conferences for the last, I guess, year and a half. This is David Henry, Communications Manager for the City of Amarillo, and everyone stay safe and thank you.
Thank you.